Right. So if you have run into, I assume because you're here, the tech issues have been worked out, but at any time during the workshop, you run into a technical concern, please feel free to send an email over to support@instituteforcreativemindfulness.com. And or you can also text over there at 330-203-1141. So I will bring into the screen with me here Roshni Chabra, who's our co-host for today. Hello, Roshni.
Hi, everyone. Good morning, good afternoon. Welcome.
All right, folks. So we're just waiting for some people to find us. According to my tech support, there's been about 10 people trying to find us. So we'll give people some time to find us. And by mistake, my my personal cell phone was given out yesterday by my office for webinar people. So running into some issues here with just trying to navigate text and whatnot. So
I see some folks coming in, so I think hopefully.
people are slowly finding. Yeah. For those of you who are just coming in, I was sharing with our panelists beforehand that I had a webinar hacked during one of my book releases at the beginning of 2013. And it was not a pleasant experience. So, as a result, I really try to set up our webinars connected to book releases, especially about controversial topics, with just like incredibly super security. So, um, here we are. Here we are. So, I hope that people are getting in. Roshni, have we heard anything from Danielle? Because I'm not seeing that they joined as a, or she's even joined as a participant yet.
No, I don't see her either. Let me text.
So before we formally get started, a question that I think would be interesting, and we're not using chat for this workshop, but we do have the Q&A enabled. So yes, somebody's asking us, no, participants are not on video for this. Participants are not on video. Participants are not on microphone. Part of that is just because we're expecting a large turnout. And yeah, even for CE purposes, you are allowed to be off camera for a webinar of this nature. For those of you who are here for CEs, though, I will say that attendance at the whole webinar is required. So at about 1:25 Eastern, that's when I will be posting the link for your evaluation. So in order to get the hour and a half CE, you do have to stay the whole time. And that's the way that we're taking attendance. Since chat is not going to be used, if you do have any questions for our panelists or for Roshni or for please make sure that you put those in Q&A. No, to get your credit, you just have to stay the whole time. I will post the evaluation at the end. There's nothing else you have to do other than be here. So while we may be waiting for a few people to join us, you may want to consider what it means to you to queer EMDR therapy. What does it mean to you to queer EMDR therapy? And that's certainly going to be a question that I'll be asking Roshni here as we officially get started. But as a introspection for yourself, I would invite you to perhaps take a minute or two to think about what it means to queer anything. right? And then especially what would it mean to queer EMDR therapy specifically?
Shall we have them journal about it for half an hour? No.
If you want to write it down, you can. If you want to just, reflect on it, you certainly can. We're not grading your papers on this one.
Hmm. Someone's asking if you want the answer to your question to be typed into the
No,
Q&A.
you don't necessarily have to do it.
Okay.
All right. So it looks like people are getting here, even people who were running into some of the tech issues with the password and the security link and whatnot. So we will go ahead and officially get started. So, welcome to the Queering EMDR. What does it mean to queer EMDR therapy webinar hosted by the Institute for Creative Mindfulness? I'm Dr. Jamie Marich. I'm the founder and director of the Institute for Creative Mindfulness. And every year for Pride, we do something, some kind of webinar, some kind of event. We did a drag brunch one year virtually, which was personally very fun for me. One year we did a healing service. And this year, especially because the Institute for Creative Mindfulness and Creative Mindfulness Media is producing this amazing book that's coming out, Queering EMDR Therapy, we thought it would be a lovely thing to host this webinar today for a CE and a half, where you get to talk to, or at least hear from other EMDR therapists who are doing this work of queering EMDR. So I first want to introduce you to my friend, my colleague, the brainchild behind the book that's coming out, Queering EMDR Therapy, Roshni Chabra. And Roshni, tell us a little bit about your journey with anything you want to share about, either your EMDR journey, your life journey, or maybe how the two came together.
Yeah, absolutely. Thank you so much, Jamie. And I have to say, if it weren't for Jamie, this project would not be happening. So thank you for everything. Jamie's been working really, really hard with me on this. And to our wonderful authors, artists, and poets who are here today, and those who could not make it, I'm just eternally grateful for folks sharing a piece of themselves with this project and with all of you. So I'm really excited to be here. Very excited for this project to come out and for all of you lovely folks to get to partake in what Jamie and I have been really enjoying. So it's been a lot of work to do this project, but so just fulfilling and enjoyable and really, most of all, inspiring at a time where it's hard to be inspired around these things. So it's given me a lot of hope in these dark days. And I know that we're fighting a lot of battles on a lot of fronts. And I'm hoping that this will also inspire some of you.
Yep, excellent. So, Roshni, what does it mean to you to queer something?
Yeah, I think when I first heard about queer being taken back as a word, initially I had some feels and I was like, I don't know about that. Don't know if I relate to it. I'm talking like 25 years ago, maybe. And I remember being like, okay, what is this? This includes everybody. And I remember sort of thinking, okay, well, queer also includes straight folks, includes political folks, includes anyone and everyone who's really here to take apart the systems that are no longer serving us, to be able to examine and sort of kind of pull back the covers. Well, I guess that's kind of funny on a lot of levels, but pull back the covers on the things that are going on behind the scenes that have been very harmful, that potentially support a few, but actually really cause a lot of harm, even to the folks who gain some privilege off of it. I think in the long run, it harms all of us. So that's kind of my approach to dealing with oppression, working on doing some anti-oppression work, is really about these systems and how we can all come together to work against them. Because if they're not serving most of us, then part of it is, first of all, knowing that they're there. That's the insidious thing kind of about these systems of capitalism, patriarchy, white supremacy, the cis heteronormativity stuff. It's all kind of behind the scenes. And so when we bring it to light, that's an important part of being able to make changes and to queer it. So queering, basically, to me, it's like the short answer is queering just means fucking everything up. It's like whatever way you can take things and fuck it up and just find a way to, make it into something that really supports everyone, not just a few.
Yeah, we like it. We like it. So, and I apologize for my distraction with dealing with some of our tech gremlins this morning. If you covered this in the first answer, I get it. But specifically as an EMDR, you've been an EMDR student now, consultant, therapist, trainer. What called you specifically to queer EMDR?
It's a good question. I mean, I remember talking to you about it a few years ago when you came out to visit. But what brought it up for me, I think, was just doing some searches and being like, wow, there's really not a whole lot specifically within EMDR therapy, but also if we take a further step back within the field of psychology, there really definitely could be more out there for our communities, how to work with LGBTQIAA plus two-spirit communities. And I think that this is a time more than ever that we really need to have a roadmap to becoming the most affirmative therapists and just folks and allies in whatever ways we can. So information has got to be readily available. And I think to me, I was just kind of like, wow, there's really not a ton out there. So that's what made me want to work on this project. And it's taken a life on it of its own on, as you've seen. I could have never imagined that we would have 25 authors and talking about all different things, so many integrations of personal experience, tips and tools, and just fucking shit up and querying it. So exactly.
Yeah,
That's what it all is.
somebody
Yeah.
even put that in the Q&A in response to what you said about like fucking shit up. And so, I've obviously been around the EMDR block probably the longest of anybody in this room, maybe only aside from Lisa, who got trained around the same time. But yeah, when I came into the EMDR community, it was like 2005, 2006. And I know a lot of us complain now about how out of touch the EMDR establishment can seem. It was worse back then. I mean, I didn't even have a thought in my mind that I would be able to be myself back in those early days in EMDR spaces. Yet the irony was that receiving EMDR therapy as a client was so much of what helped me to heal my own religious trauma, that enabled me to come out and be more comfortable with who I am. And so this has been just a dream for me to see how many of us now in EMDR spaces are queer, are out, are trans, are gender fluid, gender nonconforming, are just feeling more emboldened to be weird, to,
Yeah.
up some narratives, because we need to be doing that right now. In the times in which we find ourselves. So yeah, I thank you, Roshni, for your vision and for your, yeah, let's fuck some shit up and get some stories out there. So we're going to be bringing in some of our amazing panelists, all of whom are EMDR therapists. Before we do that, though, I just want to clear up some of the tech stuff that tripped up some of you, because Alicia, my tech person who's on the desk today, says things seem to be clearing up. People seem to be here. I don't know why it asked some of you for a password and some of you it didn't. We are looking into that, but thank you for your patience. It will not affect the CE situation. To get CE, you just have to stay the whole time. We are recording this, so I know a lot of you will be watching this on the replay later. Hello to those of you who are watching on the replay. It will be free to access. We are going to post a link towards the end about a couple places you may consider donating if you liked the content of this webinar and want to make a difference. A donation to so many of these organizations who are fighting the good fight is a way to share that gratitude forward. So yeah, your CE won't be affected, but you do have to stay the whole time to be eligible for the CE. And yeah, thank you for your patience with us as we figured out this Zoom security setting. Some of you may have heard when you came in, some of you may not have, that one of the reasons we have every security protocol on a webinar like this is webinars tend to get hacked when you talk about things that are disruptive. And this is something that is certainly a disruptive topic. So, but I'm glad that you're here, making some good trouble along with us. All right, friends. So I am going to bring in our first set of panelists here. I'll let them introduce themselves once we bring them in. We have Stephen coming in first.
Hi, I'm Steve Haladay from
Hang on,
Buffalo.
Steve. Let me get you on screen.
Uh,
I need just 1 second for that. So I'm going to bring in Stephen first, and then we have Dr. Lanza and Tawanna. And let me see who else is up for this segment. We have Reverend Karla. So go ahead, Stephen, you can get us started.
Hi, Steve Haladay. I'm coming from Buffalo, New York. He, him are my pronouns and identify as a gay, queer, cisgender male.
Great. Dr. Lanza, do you want to go next?
Sure. Hey, folks. I am Dr. Lanza. My pronouns are they, them. I identify as a trans non-binary queer Enneagram 8, of course, chronically ill, autistic, ADHD, or how I identify ADHD human.
Great. Love dropping in there that you're an Enneagram 8. Can I ask what your sign is?
Oh, wait, which sign? Like
Your zodiac sign.
Libra?
Excellent.
Yes.
Tawana.
Hello, everybody. Can you just want to do a check? Can you
Yeah,
hear
you're
me?
here. Yeah, you're doing great. Yep.
Thank you. So Tawanna Marie, I am grateful, identified she, they, the pronouns, and um, love to coin myself spicy autistic, ADHD therapist, and just doula for all souls. There was just not one soul that I can't say that I don't take joy and delight in being of service for. I'm just grateful to be here. Thank you.
Grateful that you're here, friend. And Rev Karla.
Howdy, folks. Reverend Karla. I like to be known as a very irreverent reverend. I identify as gender non-conforming, and I love to play with language, such as smashing together words such as queerific and transtastic to reclaim language. I go by they, she pronouns, and I am a Virgo. I can give you that.
Wonderful. So, for our first set of beautiful contributors to the book, now that you've gone around and just done the initial introduction, Steve, we'll start with you. Can you tell us a little bit about the kind of folks that you serve in your EMDR therapy practice?
Absolutely. So I work primarily with adults and adolescents, and trauma and finding, everybody who walks through the door, I assume that they have some degree of attachment or complex trauma until they prove otherwise. But I work with, I'm typically open to working with anybody who's willing to work with me. So I've interesting experiences working with people across the political spectrum of all varieties of religious affiliation and involvement or former involvement, people of all genders, sexualities, and Um, you know, fairly much, pretty much a mutt.
Great. And what about you, Dr. Lanza? Tell us about your practice.
Yeah, so especially for EMDR, the focus is sexual trauma. That's been kind of my bailiwick since grad school. I focus a lot around child sexual abuse survivors. So the trauma world is definitely focused more on the sexually based traumas. Community-wise, I support the queer community. I support folks of the global majority if they feel comfortable and somewhat safe to work with a white therapist. I also work with in the neurodiversity umbrella, the autistic and ADHD specifically communities. I also have history working with folks with physical, intellectual, and developmental disabilities, but unfortunately, as capitalistic funding is not available, it is harder to get them the therapy and the supports that they need. So the disability work is more in the past, unfortunately, but again, fucking shit up to make that work long term.
Thank you, Dr. Lanza. And Tawanna, the doula for the soul. Tell us about the kind of folks you serve in your practice.
I'm going to apologize ahead. I literally do not have uh, a, like a 30-second way to say this. So the best way I'm going to say is um, I am for and I am of service to any dear soul that is brave enough and has the fucking audacity enough to want to step into a space co-created and anchored in civil justice, civil rights, equity. Why it's making me emotional. Safety, to get back home to self.
Wonderful. And
It
Karla.
could be any of us.
Yep.
Thank you.
Thank you. And Karla, tell us about, your practice and the folks you serve.
Well, I accidentally started a group practice. There are 8 of us now, and we are very much centered in serving the LGBTQ community from an intersectional trauma responsible framework. We serve 4 up to 104. As far as I know, we are the largest and most queerest mental health practice in the state of Delaware. And I'm a consultant in training, and I'm really hoping to actively recruit other therapists that want to be EMDR trained and join the practice because we need this in Delaware. That's my marketing.
Excellent. So my question for this panel, you're going to meet more of our panelists and contributors in the next question. And even as I ask this question of our panelists, like the opening question I asked, what does it mean to queer EMDR therapy? You may ask yourself, how would I answer this question? So we're in Pride Month. This is a special Pride event from ICM. What does Pride mean to you? And how do we put it into action in 2025? So, Steve, we'll start with you. What does pride mean to you? And how do we put it into action in 2025?
Well, I find myself often having to explain to at least, well, often enough having to explain to some people why my phrase is typically happy pride, grab a brick. Because pride is a riot. And it started as a riot of queer and trans people of color fighting back against oppressive systems. And that is something that I think we need to recapture. We hear a lot in the news and the media and on social media, the idea and the kind of the cry of love is love, and why can't you just let people love each other? And that's a nice enough sentiment, but that's like advocacy and allyship like tier 1, and we need you like all the way up at like tier 68. Um, because the thing is, pride is fighting back against oppressive structures. And whether they're political or social or religious structures, a lot of the forces that pride needs to be pushing back against and the stuff that we need to queer and to fuck up, it's tied to this story, this myth, which is very much tied to patriarchy, very much tied to the idea one man, one woman, and the man's in charge. And that's the myth that gives all of those oppressive systems power and that they use. And queer people, by existing, prove that that story is a lie. which is why people who get their power from that story, their work is to try to eradicate us from society, from the media, from living and existing and being public. And that's why Pride is a parade. It's going out in public because by existing openly and joyfully and celebrating, we prove that their power story is a lie. But that also means that love is not enough. So what we need to do to put that into action is, one, to the degree that it's safe, to be out there, to be outspoken, and to put yourself in a bit of danger, to the degree that you're willing and able to. And not just put yourself out there, but to really look inside and say, okay, what am I willing to put on the line? And to really challenge this very corporate, fluffy, you know, palatable view of love is love, and to rediscover our roots in rebellion and resistance. And that means getting out into the streets and also getting deeper into our hearts. And I think EMDR has a place for that too. So
Thank you, Steve. What
my
about
thoughts.
you, Dr. Lanza? What does pride mean to you, and how do you put it into action in 2025?
All right, so I'm going to parallel a lot of what Stephen had mentioned, and I obviously wouldn't do my Enneagram 8 justice if I didn't say that pride means to me that we are dismantling oppressive systems and that we are fighting for Pride Month to be just something that we all go, oh, it's June. Yay, more rainbows, because we're all living free and we're all living safely and we're all living comfortably and we're all living in a space that we can achieve whatever we want to in our lives without systems holding us back. And so looking at how to do that, I have this metaphor that I think I need to work on because I suck at metaphors, but basically this concept that if only some of us are carrying a mountain, we're going to crush. We're going to be crushed under this mountain. But if we all carry a rock from that mountain, we're going to be fine and we won't feel as tired or as exhausted or as lost. And I think one of the things, not only as a social worker, but what we're feeling with the weight of the world right now is not everybody knows to pick up a rock. So when we're looking at advocacy and agitating, we need to work within these systems that were built while we're actively dismantling that. And we need all kinds of rock holders. We need ones who are going to be the tech gurus to fix Zoom to make it safe without any passwords, right? We need the folks that are amazing at graphics and can post. We need these small businesses that are ready to get together and feed folks and clothe folks and make sure that our clothing fits perfectly. Shout out to Pransome for all their amazing work that they do to make clothes fit bodies. We all have a role. And so we need to pick that role. We need to define that role, and we need to communicate that role to our communities. So I can be like, hey, Jamie, this week, this is my role in advocacy, and this is what I'm going to do. So I'm accountable to my people and my community, and we will make that change, but we can only do that if we do it all together and all pick up our stones.
Thank you. Tawanna, what does pride mean to you, and how did we put it into action in 2025?
Pride is relational. It is embodied. It is consent-based. It is queer. It is decolonial. It is sacred. It is queer joy anchored and synonymous with liberation. And in 2025, it will be built by those of us who were never supposed to survive, but did. And not only survive, but have the audacity to reclaim the tools and traditions and truths that were once used against us. And that's how I imagine that we will pay the path forward. Thank you.
Thank you. And Rev Carla, what does pride mean to you, and how do we put it into action in 2025?
Well, as I like to say, once upon a time when I was a baby dyke in the early 90s, I was out and proud when most people were closeted and afraid. I wore t-shirts such as, nobody knows I'm gay, and I'm not gay, but my girlfriend is. And, as I look at today and think about how so much of the early 90s are replaying in our contemporary context, but at a higher decibel of destructive intent. Metaphorically, Dr. Lanza, I would say And Steve, those bricks are around dismantling mountains and dismantling walls to build bridges. Because what also needs to occur within the Pride community is many of us know what it means to be in the out group marginalized, but some of us hold privilege in group and out group at the same time. And those of us that have privilege in the in group, such as Caucasian, needs to recognize and be the advocate and voice for those who are marginalized in ways that we are not. Related to what I share in the chapter of the book, I think too, as therapists and more specific to EMDR, is we need to cultivate safe enough space for every part of a person to show up to work with their trauma healing. One of my transtastic, plural, fabulous clients yesterday, we were reflecting upon how claiming space in the external world is too often rare yet validating for their other headmates. And so we need EMDR therapists that are not afraid of working with plural, fabulous folks, because in the queer community, there's a lot of us who have been through complex trauma and need every part invited to the healing journey. And maybe that t-shirt would look like, I'm not plural, but my parts are. Just saying.
Yeah. Thank you. Thank you. Thank you. So somebody did come in with a comment here in the Q&A, more of a comment than a question, but I do want to read it because I think it's very relevant to our discussion here. For me, living in Los Angeles, even with the importance of LGBTQIAA pride, I cannot fail to mention what's going on with immigration. And in fact, my pride in my city and how that is synonymous with queer pride. Yeah. Thank you. Thank you. So Roshni, I'm going to turn the question to you now. What does pride mean to you? How are you in 2025?
I forgot to copy their answers. No. So yeah, I mean, I think this last person makes a great point. What does pride mean? I mean, I think we look at pride as something that has become this love is love. And I was talking to someone the other day who was like, oh, things are really bad for queer folks. Oh, I didn't realize that. And so I'm like, well, yes, it's happening on a larger scale. And at the same time, things are always kind of happening in the background, even when we had more rights, even when things were moving in the or in the correct direction of giving more freedom, human rights, all those things. And so pride really means a reminder and a time for us to figure out what our communities need and what we need from our communities. And this year, it is very especially highlighted that we need to support each other, we need to show up, and we need to also learn to have compassion for ourselves as much as possible, because this is a lot. And we've got to keep each other here. So community and community care is the most important thing at a time like this, but always recognizing that just because things have moved forward and it's gotten better, I don't think any of us have really let our guard down.
Right.
If we look back to when the AIDS crisis was happening and our communities were abandoned by everyone, that's when you look back and you see that is when pride was in action. And you're seeing that again now. So we always remember that our rights are not to be taken for granted, that we have fought tooth and nail for every inch, and that we will have to continue to do that even when things get better. So I think it's important to have a balance of having a good time, celebrating our communities, and also activism and queering the shit out of everything fucking up the systems that no longer work, or that maybe never, or maybe they are working as designed, right?
Yeah. They're working as designed to keep us in our place, of course. And one of the reasons I always like to do our ICM Pride event towards the end of June is as a message to say this is not just a June thing. It's something we have to be committed to every day. And Yeah, so just a quick commercial here at the midway point as I bring up our next set of panelists. Remember, you do have to stay the whole time to be eligible for the CE, although the replay will be made available in the hour or so after the webinar. So you can go back and maybe watch anything you may have missed at the beginning, although the beginning was a lot of frantic, oh my goodness, people need their passcodes. And let's get people in. But anybody who was struggling to find us, you got here in time for the good stuff. And hello to those of you watching on the recording. QueeringEMDR.com is the website, QueeringEMDR.com. That's where we're going to continue to post resources. There is a pre-order link there for the book if you should be interested. I'm technically not allowed to talk about that too much, but hopefully you'll look the other way. And yes, everything you need about the book is there, QueeringEMDR.com. So I'm going to bring up our next group of panelists here. Just give me a minute to bring everybody in, and then we're going to shift to talking a little bit more about EMDR specificity. So I see everybody starting to kind of fluff their hair a little bit, which is great. And oh, I'm on camera. So I'd first, as I did when I brought up the first group, I'm going to do a go around. Jenn, you are spotlighted. Let me just see who I think. Who am I missing? I think I got everybody. Yes? No, Carmine. Yep, now we got everybody for this panel. So we're going to do a go around. I'll just call you in the order that I see you. And if you can just give your preliminary introduction about who you are, how you identify, anything you may want to share initially. So I, with great pleasure, would like to introduce Lisa Hayes, who's also the ICM director of our BIPOC specific EMDR training cohort, which we affectionately call the Dream Team here. So Lisa, I'll let you go ahead and introduce yourself.
Right on. Thanks. So I am Lisa Hayes. I use she, her pronouns. And as Jamie said, one of my biggest points of pride is being the primary trainer for our BIPOC cohort, which is an affinity space to train non-white clinicians in EMDR therapy. So again, I appreciate Dr. Friend's recognition of those of us, the global majority. I live in Columbus, Ohio. That's in the Midwest. We're having a pretty hard time right now considering issues of equity and access to services. So if I'm really super vulnerable, I'm feeling like energetically in need of this space. So I appreciate being here. Primarily in my practice, I'm seeing folks who identify as having complex trauma and dissociation. I see a lot of activists in my community and artists and feel really excited to be here. I mostly see teens and adults.
Great. And we'll go to Mariena and then Jenn.
Hi, my name is Mariena Joy. I use she, we. I feel like how I identify is very long. I'm queer, neurospicy, ADHD, like thin, demisexual, kinky baby girl, kink mentor, poly, plural, biracial, South American, indigenous, white passing, intersex, trans queen. Thank you. I predominantly work with adults and adolescents at this time, but I usually have one or two youngsters on my my caseload. I mostly work with queer and neurodiverse ADHD folks like myself, and those like myself who have complex experience of dissociation, whether that's amnesia, living systems of parts, psychogenic seizures, or other somatic experiences. About a third of the folks that I see are providers, medical social work, or their families. And the rest are Medicaid. Typically, the work I do is like loving family parts work, like family therapy inside of ourselves. I do attachment wounding and trauma wounding to work with like our reflexive suppression of ourselves, to embrace the wholeness of who we are and falling in love with who we are, and a freedom and joy to choose who to be, who we are, when we choose to be who we are.
Thank you. I'll go Jenn and then Cash.
Sure. Yeah. So let's see, my pronouns are she, her. Much less exciting than Mariena Joy. I identify as lesbian. I feel like I'm a dinosaur when I say that, but I've been a lesbian for 35 years. I've been out, and that's never wavered. I'm old school. Um, what else? Let's see. I'm total opposite. Let's see. I see older clients. Most of my population I'm a sex therapist, mostly sex and couples. So I see mostly clients that are about 40 to 70. I like the older population quite a bit. They're coming in with just dissatisfaction or dysfunction. So I sit with a lot of clients that are kind of in that space of, kind of reevaluating their sex lives. And it's complicated, a lot of existential sort of feelings around body and satisfaction. So yeah, that's where I'm at.
Excellent. Thanks, Dr. Jenn. And then Cash and then Carmine.
Hello, everyone. I'm Cash, they, them pronouns from Detroit, Michigan. And we are a tree first, a dancing wizard second, Aries rising, Scorpio Mars, 5/1 projector in human design, a transgender, non-binary, kinky queer, and we are a plural system as well.
Wonderful. And then Carmine.
Carmen, they, them. I queer, non-binary, trans person in recovery from substance use, religious trauma, other traumas. I'm an Aquarius, an artist. Recently started a production company where we really like to fuck with Shakespeare texts and make it kinky, queer, different, better. Um, and I am living in Belfast, Maine. So it's really fun to bring that production company to tiny town Maine. I also work with mostly queer and trans rural folks in Maine. Usually, folks are disabled activists, folks who are neurodivergent, also healing from religious trauma, and expressive arts therapists. So bringing in all kinds of different stuff, different creativity makes for very fun and exciting and deep sessions. It's great to be here.
Great to have you here. So, the question I'm going to ask you, it means a lot to me because I mentioned already how I've been around the EMDR world a long time. And at first, it struck me as a very inhospitable place. It could still be inhospitable in a lot of circles, to be clear. Yet, a fond memory I have, and I write this in my foreword for the book with her consent, at the 2010 EMDRIA conference was the first time I ever came out to another professional about my bisexual queer identity. And it was to Robin Shapiro, who a lot of you know from her amazing work with ego states and EMDR. And I met her through a common friend at that conference. And we were walking down the street in Minneapolis to go to lunch. And she was just chatting as Robin does. And she referred to herself as, she's like, well, I'm half queer. And then kind of proceeded that into explaining her bisexual identity. I'm like, well, I'm half queer too, then, by that definition. And at that point in my journey, I was out to anybody who mattered, like people in my close circles. I was out to myself, which I think is the most important coming out we have to do. But it was a very big crossing of the threshold for me in a professional space, which happened to be like our biggest EMDR conference. And I think I've had this passion in my heart since then about how more of us need to be out. I'm so delighted to see how many of us are out now in EMDR spaces, especially for the baby professionals who may not know if they are safe or safe enough to be themselves. So I just love, especially because there is still a lot of conservative bias in EMDR spaces, that there's so many of us here who are like, yeah, I do EMDR. I love EMDR. And I am being unapologetically myself. So my question, and Lisa, we'll start with you, and then we'll go in the order that you introduced yourselves, is what are one or two key messages that you have for EMDR therapists about either working with someone like yourself or working with the people that you serve? You have a platform to talk to all EMDR therapists everywhere. What would you say, Lisa?
Quite the setup. First, I feel like I have to just name I'm a Sagittarius. I feel like we went on a vibe there and I did a little bit. My bad. I'm a Sagittarius. I do love to travel. Yeah, I think it's an extraordinary question because I think it speaks to the integrity of our field, right? This idea about like what messages might I have for folks, and I'm doing that in the interest of like building community, not tearing it down. Like I just kind of want to name that, but one of the things that I thought about as I was thinking about this question is I really wish that therapists in general, and certainly EMDR therapists, would start with like exploring their own relationship to queerness. And I think often what I find in conversation when I do come out, and whether or not folks perceive me to be queer or not, is kind of its own issue that I don't hold a lot of space for. But I think I'm always interested in how folks perceive you differently, perhaps when you come out in that way. And so my thought here is like, can you be curious about your own consumption of queer stereotypes, right? And some of what I would consider the more pervasive kind of queer tragedy tropes, right? This idea that like all aspects and all identities that have proximity to queerness are only viewed through the lens of tragedy. And I think that does something really violent to what is like resilient and joyful in our community. Do you know what I'm saying? And so it kind of forms this idea that like queerness itself is tragic. And I think especially in EMDR therapy, when we're looking at what are we actually targeting, right? We are not targeting my existence. I'm targeting the difficulty of existing in systems of hatred and oppression, right? And so it's kind of like if we pull away from some of those tragedy tropes and kind of shift that lens less on the person who is looking to survive hatred and more on the community that is perpetuating it and holding it, I think we might do a better job, even in being accountable to like what I would consider like the blood on our hands as a profession, right? We all rely on these diagnostic manuals that are deeply problematic and violent and continue to harm members of our queer community. And so I think maybe from an EMDR standpoint, to really shift that focus more towards liberation. And I find that as a person in the intersections of my own identity, as a non-white person, as a queer person, as a woman, as a person operating in a larger body, right? That I feel like if our focus is on how tragic that existence is, then we're kind of missing the opportunity to shift our way towards liberation and to say, right, that like, let's stop consuming marginalized and targeted folks through that single lens of tragedy, while still acknowledging that there's work to be done, right? So I think it's kind of holding that complexity of like, how much of that am I consuming and then projecting onto the queer folks that I'm supporting. And if I'm totally transparent, I think there's that work to be done within queer family as well as outside of it, right? Because I think that happens often within our community as well.
Yep. Yep. Thank you, Lisa.
Mm-hmm.
So Mariena, for you, what would be one or two things you'd like to say to EMDR therapists for working with someone like you or the people you serve?
Well, first off, thank you, Lisa. That just like that brought up so much joy in myself, like as I'm thinking about my own identity. So I'm going to target just like a narrow band of my identity and a narrow band of the people that I serve right now, and that is the intersex population, because until Queering EMDR comes out, there's nothing published about intersex and EMDR. So this is what you get. The first is like I want people to know more about what intersex means. We are at least as common as redheads. Like that's a ginormous amount of the population. A redhead, an intersex person. Intersex is an umbrella term for unique variations in reproduction, sex anatomy. These variations can appear in a person's chromosomes, genitals, sex hormones, or internal organs like testes or ovaries. There's over 40 known variations, but there's so many more, and there's so many of us that don't know or didn't know that we're intersex. Intersex is not about gender identity, or sexual orientation. It can affect those things, but intersex is about your sex. It's not male, it's not female, it's intersex. Some of us identify as transgender, but many of us don't. Things to know is that we exist. There's so many of us. My God, there's so many of us. And we're just not really talked about. It's not erasure if we don't exist in dominant culture. So I encourage folks just to get to learn a little bit about what intersex is, because you have clients who are intersex, whether they know it or not. And a lot of the work we do with our folks can be viewed through like an intersex lens, just understanding how being intersex, whether we know it or not, can shape our lives. Now, that's not always trauma, like Lisa pointed out. There's a lot of joy and just life experiences. Now, that doesn't mean you need to be an expert in intersex. You don't need, and don't grill your clients on, tell me everything about your intersex identity. But, be open if somebody is able to share and knows that they're intersex. Like, go Google it, go learn about what that means, what that looks like, and be open to how their experiences may have shaped traumas or joys. And maybe go check and see if you're intersex yourself, because you might be like me and not have known it.
Give a preview that Mariena's chapter gives us a lot of good information about how to do that. And it's just an important piece in the evolution of EMDR scholarship to have the sharing of that lived and learned experience out there for EMDR therapists. Jenn, what would you like to say to EMDR therapists about working with old school lesbians like you or people that you serve?
Oh, funny. We don't actually work with that many old school lesbians. I'm in a small town, so there just aren't that many of us, and I'm friends with the few that I know. But what I will say is that because most of the clients I work with are around sex related issues, I tend to do a sexual history intake, which is really helpful, right? I most of my clients, be it a couple or an individual, is I go and I will do a sexual history intake. So tell me about, the first basically 20 years of your life. We'll do it in chunks. And I look at kind of what were the messages you got, religiosity, early expressions of affection, was there any inappropriate things that happened, looking for trauma, that type of thing. And during that time, I'm seeing like targets and that type of, anything that would be coming up. But influences, messages, that type of thing. It's so helpful because that whole time I'm seeing it through that lens of what eventually is going to be great for EMDR. And more times than not, I feel like it goes towards something through the sex therapy side of things, is that it is like something is wrong with me, basically. Like I'm not good enough is what comes up over and over, a variation on that. Either I'm not safe or something is wrong with me. Those just are like the core themes within my work. And it doesn't matter if it's who is sitting in front of me, and if it's erectile dysfunction or if it's pain with, penetration or whatever the presenting issue in the DSM would call it, whatever. It just over and over again, I'm sitting with suffering. And it's like, EMDR is such an incredible tool. And if you can get curious about where this person has been historically, it is so helpful to use this tool. And I don't know, I so appreciate this, as something that has been transformational, to help with, with the sexual journey, because the behavior, the end piece is what kind of brings them in, but it's the history. And it's so I don't know. I just most of my clients don't assume I'm gay, but I will tell you that I come out over and over again all the time because it matters, and I think it really helps with safety building and with community building. I'm in a small town. I do a lot of queer support because it matters. And I think I don't necessarily like blanket put that out there, but I come out as it seems relevant with clients. And I think it does help in this forum. So yeah.
Thank you. Thank you, Jenn. And Cash, what about you?
Meandering.
You have the platform to speak to EMDR therapists. What would you like to say to them?
Hey everybody. Okay, so I'm gonna try to go quick here. So I just want to say we work with transgender teens, so just shout out to them surviving this world that we're living in. They're some of the coolest, strongest people I know. We also work with people with dissociative disorders and people who identify as systems, as well as doing psychedelic medicine life coaching. Let's see. first thing I'll talk about is working with parts specifically with EMDR. Please target people's parts. So if they are a system, it's very helpful because it helps make more, it's like sense making for people who identify as plural. So for my own work, last couple of years, I've honed in on our 5-year-old dimension, our 13-year-old dimension, and now we're working on this like fem piece of self. And each time we go through a big reprocessing for a dimension, it's like as if we grow up more. Our caretakers in this world, a lot of them were emotionally immature, right? I know a lot of us feel that way. So EMDR can help our parts grow up. So like for 5 is speaking right now is like, and they're saying like they didn't go away. They just are more resourced. So now 5 didn't change. I still have a 5-year-old inside of us, but they know to go to Cash or go to Spencer or go to the adult parts to have more resourcing inside of ourselves instead of looking for it outside of self in attachment figures in our world. So try to target parts specifically. And then the second piece is psychedelics and dance. So queer is psychedelic. Psychedelics are queer. Dance is queer. It's all connected. And so if you yourself as a clinician don't have a dance practice, formulate one with yourself. If you don't talk to your clients about dance, start doing that. If you have a client who goes through a huge EMDR reprocessing session, it is highly appropriate to tell that person to integrate with using dance. If clients if they're scared of dancing, that's a great avenue to be like, hey, why are you intimidated to have a self dance practice? Is that embarrassing for you? Talk to your clients about it. A lot of your clients are going to start to understand that psychedelic medicine is here to help. The war against drugs has made everybody think that psychedelics aren't very, very helpful in the world of therapy, but that is changing exponentially. So if your client's like, I just did I sat with mushrooms last week, don't ignore that. You can ask the client what came up for you on your psychedelic journey. And then you can actually target in EMDR parts of the journey that were difficult. So in that way, psychedelics can kind of interweave with EMDR. Dance work can kind of integrate with EMDR, and as well as the parts work. They all kind of flow together in my mind. So that's kind of the 2 key messages there.
Great. And then Carmen, tell us, your message to fellow EMDR therapists.
First, I just want to say I think EMDR is all about making room in the brain, room in the body, room in the room. And just hearing all of our identities or saying them in this space, I'm like, oh, I'm feeling like we are making room as we speak. And 2 things that come up for me are that in sessions with my clients, identity is central and not peripheral, or identities are central. And the other thing is letting their creativity be a language of the therapy and not just a topic of it. And I think there's a lot of room in EMDR to bring all of those components in. It also requires me to be flexible and to be open and claiming my own identity pieces as well, sometimes by naming them in the first session and inviting them to share what they know about themselves, knowing that we'll probably discover more down the road. Because I'm recognizing that we can't use the same pathways we were using to get to where we want to be, but also honoring that this is where we are right now. This is who we are right now. This is our creative tools right now. Let's work with what we've got. And the other thing about all of that is all of this takes time, which in our capitalist society, we only use time as productive measures or exploitive measures. And recognizing that I don't want to input exploitation and production into the EMDR process. So sometimes it's really about just slowing things down and getting to know my clients. And one thing I've been deeply, deeply and personally learning about taking time is I've led and guided and been with so many of my clients going through gender affirming surgeries. And for this Pride Month, I've been sitting at home recovering from my own top surgery and thinking about productivity and how to measure my own success as a human, and recognizing that actually just me sitting on the couch and healing and letting my community come to me and care for me is making space and making room. And in claiming myself and showing up in my sessions lately, I've noticed my sessions are very different with my clients. I'm attuning with them differently because I'm now more attuned with myself. So I think a lot of us have said, like, get good with yourself, get good with yourself, explore, be willing to make room, because then you can help your clients make more room in their bodies.
Yeah, thank you very much. So Danielle, I have done many panels and interviews with Danielle, who's a contributor to the book. So I'm so glad to see you, my friend. Sorry about some of the tech issues. Glad you're here.
So I don't claim to be a tech whiz.
It's okay. It's just like, yeah. So why don't we start by having you tell our wonderful audience a little bit about yourself and the work you do in the EMDR community?
Okay, thank you. I'm an LCSWR in New York State. I'm certified through EMDRIA as a trainer and consultant. Right now, I'm on leave from my training consulting work that I do for the Trauma Institute. I have some health issues the last 6 months. So, Carmen, I agree. I've had lots of time to reflect in the last several months. And I think it's always helpful for us as therapists. I'm in the unceded lands of the Tawanna people, which is in white people terms, that's right outside of Buffalo, New York. And I have a private, hi Steve. I have this is like Hollywood Squares today. So I work with primarily gender diverse people, late adolescent, late teens, early to mid 20s, and their allies, friends, and some people who've continued to see me is because I went through the coming out process about 5 years ago, and I still have some clients that I do see who've had the opportunity to become strong allies, and we've continued our journey together. So I've been pretty busy. I've presented. I've worked with Jamie. I've done a lot of work. Like one of the things that happened for me is when I went into this work, and I was out as a therapist. So there was a transition, a deep change for people, but also was a change for me too, because my contact with the quote transgender community, I hadn't been active for about 15 years, and it had changed significantly. And I think so. I really learned the concept of therapist humility very quickly. And I had a lot of stuff going on, and it's at my point in life, transitioning, and whatever I go, because we all have a personal process. There was a lot of factors to address. Okay, there's a lot of personal, there was a lot of familial, and the clients that I was working with had a wide range of experiences. And I learned a lot from them. I was able to help them. And I think that concept of therapist humility really fits. One thing that really strikes me is that clients telling me that their past therapy experiences, that how they would felt that their narrative or their life story was constantly being questioned, like by providers, like they had to prove it. And it's one of the reasons why a couple of clients have told me they really prefer people that are in the community, because that narrative is not challenged, it's accepted. And I think that's one of the, so traditionally in the mental health field, I've lived through periods where trans people and queer people were so marginalized. And, unfortunately now, I'm really concerned because it looks like there's a turning back in rights. And, what can we do? I'm really impressed, though, by this group. I come into this group, people are doing really creative, innovative things, which even 5 years ago, I didn't see. So people are really, it's part of pride, it's part of our community, but really applying treatment technology, treatment techniques in a way that meets the needs of our clients. And they're not just put off kind of like in a category as, these people are really hard to deal with. who knows what you're going to do. Now it's proactive. How do you live your most complete life? So I'm impressed by that.
Great. So Danielle, just one more question for you. Take about a minute or two, then we're going to bring everybody else in. It's the question I asked this part of the panel. You have a platform now to speak to EMDR therapists, whether it's maybe some of the more creative types or people who don't seem to get it. I know I've talked a lot about that presence in the EMDR community. What would you like to say to them about working with someone like you or the people that you serve?
To the people that don't get it?
Yeah. What would you say to the people who don't seem to get it? Let's go there with the question.
Well, I would ask them to follow their ethics. And I would give them themselves the opportunity to get to know queer people. And I think there are more trainings. I think DEI trainings, especially within EMDRIA, has been very helpful. But I would say keep an open mind. Allow yourself to be flexible. I mean, I found this out in my early trainings because people would go to the trainings and they think, well, I have this client and they're this, and I don't know what to do with them. And they're always kind of in crisis. And it was because they weren't accepted. And I would also say, if you can't accept queer people and be in honor of them, then perhaps you shouldn't work with them until you're ready to.
Thank you, friend. So I'm bringing back in our other panelists, and we're now going to go to the Q&A. There have been some questions that have come through. A couple of them we've been able to answer live, just using, not answer live, but answer via text, especially the more technical questions. Hang on, I'm trying to juggle the tech here myself. I don't know if it's going to let me spotlight more than 9 people. I think I'm running into that right now. So what I'm going to do, we'll figure it out.
If you unspotlight all of us, that might work too.
That's what I think. Just put it, yeah, if you can do that, Roshni, unspotlight, and I'll just put it on gallery from there. So Lisa, there was a question that came through for you. I think you may have answered it individually, but I think it's a good question to go with publicly. And I'm trying to find it now. Yeah. Is there room for allowing a client to mourn the reality of their gay identity when they are upset about the normal life they imagine for themselves without making someone feel like you're coming from a tragic perspective?
Yeah, I did try to answer that question, and I think I'll just try and echo it. Like, I think we're in the business of holding space for grief, and for allowing folks an opportunity to kind of manage any discrepancy between the life they thought they would have and the life that they actually have. And I think there's value in that. I think my point is just that we're also, if you're looking at it from a liberation lens, we're also looking to access some awareness about the systems that are in place that have created an opportunity for that grief. And being critical of those and thinking critically about how we're inviting folks to navigate those realities, while also creating an environment where we're linking into community and connection, right? And so I think it's this balancing work that we're often doing about any aspect of a person's identity that is different from what they imagined, which for me feels like maybe every part of my adulthood is maybe a bit different than I was led to imagine or believe that it might be. So sure, I think, I think nothing makes sense if it's all the things, right? So I think there's always space for the individual person and their needs. But yeah, for sure. I mean, leave space for grief, but I think that's different. That's someone identifying grief as a part of their existence in the world, which is different than you making an assumption of grief about a person being queer, right? So I often see that around coming out narratives, that people feel like all of those stories are violent, that they result in you becoming unhoused and leaving, losing access to your primary family or friend group. And that is often true. And I think we can be critical of the systems that hold up that kind of violence and hatred in our families and communities, while also acknowledging that there are a handful of us that did not have that lived experience. And so I think what I'm talking about is the assumption of tragedy, not necessarily the capacity to hold and treat tragedy when it does show up. I think that's I would trust your clinical skills there to do that. I'm just saying not to make that assumption that queerness at a foundational level it supports, it's like difficult or painful or tragic. I think that is kind of perpetuating that stereotype, and there's like a kind of violence embedded in that. So
thank you, Lisa. And yeah, if you have a question, if you want to see all of us, you should be able to put it on gallery view and you can see all of us, because that's the perspective that I have here on the screen. But again, I don't pretend to solve Zoom gremlins in a minute of time. So if you have a question, you can go ahead and type it into the Q&A. We'll get through as many as we can here live on the webinar, although a lot of our participants are putting in text answers, which is certainly appreciated. So Dr. Kennedy, Jenn, you got a question here for you specifically. Is there a specific history intake somewhere about sexual history? I know you're going into a little bit in your chapter in the book, but for people who want to know more about taking a sexual history, where would you point them in the direction of resources?
Yeah, I originally got that format at a lecture, Psychotherapy Network lecture from Suzanne Eisenessa, I think is how you say her name. She's an analyst out of New York. The basic structure is you just do it in chunks: childhood, adolescent, early adult, and you ask them for significant experiences that happened during those years. Anything that was relevant. It's sort of a little bit of a timeline builder. So what happened during those times? What do you recall about anything to do with sexual? Did you witness affection? Did you what were your early experiences in terms of what you saw, what you experienced? Like, what was the first time that you had interactions with peers? What was your first sexual experience? Was it positive, neutral, negative? You want to hear how they're talking about it, what occurred, and what is their takeaway from it, because that's going to be an indication of what their general view of self is and their view of sexuality is. And so you're just kind of looking for some of those, general experiences, and that's kind of building that narrative that they are likely taking into how they feel about confidence, self-concept, heading into adult experiences of sexual ability. And so it's actually quite helpful. It's stuff you wouldn't think to normally ask, but it's usually embedded in there in terms of how they view themselves in the erotic space.
I could just add to that. I know I've talked to clients about that, and then sometimes they feel like they're being helpful by going home and writing out their full sexual history, but I know that can be very triggering and bring up a lot. So I encourage folks to do it with the client in person and go as slow or as fast as you need to, right?
I usually spend like 75 minutes, and and sometimes it spills over into a second session, depending on how old they are, depending on how complicated their history is. Sometimes you need more containment if there's more trauma. But take the time, and I split up a couple and do it with each of them, because that's informing what's showing up in the room. And it's really good information to know, because that's back leading them into where they are now. So it's helpful for target building. It's helpful to know if they need some processing, because that might be holding back what's showing up for them sexually, and from intimacy perspective. Yeah. So.
Thank you very much, Jenn. So this question's getting some buzz. I have recently struggled with some EMDR sessions that initially start targeting a client's individual target problem, but then as they're going through the reprocessing, bilateral stimulation, getting to things that I see as more systemic oppression related. And I think I'm needing an interweave or some kind of way to address that to move forward, since I have often found myself pausing EMDR there and doing either liberation psychology or feminist therapy in those spots. I'm hoping to hear how you navigate this, as so much trauma queer and trans clients are navigating is systemic in nature. I know we've touched on that a little bit, and a few people have chimed in, but any of our panelists want to take that question from Dora? Thank you.
I would love to. I did a little bit on the in the chat, but I love this question because this is, I think, part of the heart of the work that I do, freeing folks and helping them find joy and love for themselves. First off, there's many things connected to systemic oppression, but I kind of, with my work with folks, I chunk it into internalized oppression and then external experiences of oppression. And there's so many ways we can address these. And I'm sure all the panelists have different ways they do. And your ways, Dora, are great too. One of the things I do that you could probably just add into the work you already do is after psychoeducation or after some kind of pause and processing where we go to EMDR phase 2 and we're doing some other resource is then taking what we've just done then and asking what was important from this. What do they want to remember? Is there something they want to strengthen? Is there something that the part we were working with needs to know? And then we do BLS to strengthen it, or we go back to processing and we talk to the part and be like, man, here's this new information. There's so much that could be done here, but that's just like a little window of the work that I do. And you're doing great, Dora.
Can I offer a bit of yeah? So one of the things I might encourage you to explore is this language around oppressive cognitions. There is some literature within the EMDR community that looks specifically at those cognitions that are co-located, right? That do have some internal manifestation, but they're also being reinforced from these external social realities and thinking about the kind of collective experience of oppression is one of the things that oppressive cognitions can do. And so in that way, it's a little bit of like decolonizing this work and creating community within our pain and survival. So I really appreciate them. So I would just maybe encourage you looking up and thinking about doing a little bit more research or reading around oppressive cognitions and what that might look like to have those oppressive cognitions establish separate targets, right? So it could be a cognition of I'm not safe, and that might actually be co-located. There could be an I'm not safe that is kind of that auto-punitive internally generated thought that we would think of as a traditional negative cognition. And then there could be a more kind of collective, we are not safe because we are queer, because we are, whatever in the world. And that likely has a separate kind of associated neural network, right? So we're using those oppressive cognitions to establish separate target memories that might address some more of that oppression-based distress. So I would just say oppressive cognitions, there's some work and some writing about it. I would encourage you to check it out.
Thank you, Lisa. Tawanna.
Thank you. And also just to add on to what's been gifted in this space already is that, and this may not sound sexy or, complicated, but it can also be about, in our society, many of us, especially those that might carry optically characteristics of peoples that come with positionalities of power and privilege, often given messaging that they're not, that to feel is to fail, that are often dislocated and marginalized from their own pain and trauma and not allowed to own it and even know that it can be a thing. Also in our society, where we weaponize ourselves and each other around needs meeting, coming into a healing space, there's a lot that our dear clients contend with. And often we don't even realize from the provider's perspective that our clients, no matter how old or young they are searching for a gaze that will cement their positionality on this earth, their worthiness. And that may mean that they're also contending with the fact that, like, do I even deserve, any one of us dear therapists to show up for our healing? Do I even deserve to own and honor? Do I even get to deserve to call what I experienced trauma or anything? And that often plays out in this very sticky, sneaky way when we get into reprocessing, because when those affective circuits are lit up, that is literally what happens. And at the core of that, I always ask myself, one, has neuroception of safety been established? Do I know where my person's parts and pieces are in relation to their sense of safety of being in this space? What are they even telling themselves about even being here? Are they calling bullshit on therapy, even though they're talking a good game? What are they really telling themselves about what it means? And what do they think I think it means? So high level answer, but I wanted to be able to contribute as well. Thank you. Love the question.
Thank you very much, Tawanna. So
I can
Sorry, Jamie, if I can just add one more thing about that.
Go ahead. Go ahead.
Yeah, I think absolutely it's a great point to look at the fact that it's kind of, I write a little bit about this, but I call it oppression trauma specifically. And Stephen writes about queer trauma specifically because it shows up differently, right? It absolutely is complex trauma. And yet we develop so many ways to cope with oppression. So I think it's important to talk about that in a different way, because I can be working in a session as a client with oppression and I can go outside and hear something transphobic or homophobic. And so it's an ongoing trauma, and that piece of it is really important to directly address with your client. Back to you, Jane.
Thank you very much. So I'm going to throw one more question out, not throw because it's an excellent question. But just to let you know, hopefully you are now seeing the chat on your end. And I put the evaluation link for today's webinar. We're not taking questions on the microphone. So if you do have a question, you can Q&A it in the Q&A tab. If we can't get to it on camera before we end, then hopefully some of our webinar panelists can weigh in. But in order to get your CE for today, you do have to fill out this evaluation link. I'll go through a little more of the housekeeping on that after we take our last question. This is such a perfect question for our times. Any advice for helping a parent of a teen coming out as trans? They're supportive as far as parenting goes, but they don't agree or want this for their child, but letting them explore this side of them. They're asking for care for the teen that is allied, but not affirming. So I'm getting messages. Oh, I see why you're not getting your evaluation link, because I sent it just to the hosts and the panelists. Hopefully that should be coming through now. So yes, the question about supporting trans children. Stephen, we'll go to you first and then Karla.
I think that one of the important things to keep in mind as far as a starting point, because it's not going to have the same ending point and the same path, but to start by asking, okay, how would I help a parent and how would I support the parent of a teen who didn't want anything for their kid? You know, if you take out the queerness first and ask, okay, how would I approach the situation if it didn't involve the trans identity of the kid? That would likely give you some ideas on places on where to start. And this where that would go, I think, with the parent of the trans youth is, what does this really mean to them? What are their beliefs? And really sitting in, what are the values? What are the assumptions? What have they internalized? Because this doesn't sound like it's about the kid. It sounds like usually in this situation, there's something in the parent. And if you can kind of unpack what the parent is really carrying, you can find that at the heart of that is a very deep love and concern for the well-being of their kid. And that is not about their being trans, it's about their being trans in the world as it is. And that can then maybe help to shift them to see, okay, what is my true worry and how is that coming forward? And that seems like it might be one good place to start. So I'll hand it off to others who might know more than me.
Let's go to Karla, then Cash.
Thank you. I tried to chat a little bit in there, but the Wi-Fi is slow here. What I want to say is I do speak with parents often about moving the social location off of the child and the fixation on the child and the child's behavior, the teenager's behaviors, and I shifted onto the culture. And it has helped immensely, particularly with clients that have intersecting marginalized identities, of going, I'm so sorry, our culture has made no place for your family. Because the problem's not the kid, it is the culture, and to align the parents with the kid, and to acknowledge that there is a fear response that often comes around safety. And you trying to keep your kid safe on your terms will separate the child from you and isolate them further. The other piece is around a grief response is every time a parent knows they're going to add to their family through adoption or birth, they come up with their own dreams and hopes and visions. And the best parenting is to release their personal hopes, dreams, and visions and allow the kiddo to come into the truth of their own story and narrative, to walk beside their kiddo in having that individual come up with their truth. And so parents have to let go of wanting to imprint onto them. And the parents that have the toughest time letting go of their narratives of what they want for their kid are the parents that haven't worked through their own trauma.
Thank you, Karla. And before I turn it over to Cash for their answer, please go and visit the chat. I posted a few things there, including your evaluation link for the webinar today, also the pre-order link for the book, and 3 organizations that we're elevating today if you want to make a donation and support. Cash, let's turn the floor over to you.
Just want to really drive home how important it is to have a therapist in those kids' corners where the parents are disagreeing with, what the child naturally knows what is right for themselves. And so family therapy all the way. If you can get as many family members in that session as you can, it's more helpful because at least the child has some psychological backup against the intrinsic transphobia and homophobia in the family system, and then it's up to the counselor to savvily navigate communication between the child and the parents, because without you, the parents are just like they're in that dynamic with their parents with no help. So at least you as the adult queer affirming person can choose your words wisely, right? To keep the parents, because if you can say the right thing to them in an adult way, you can at least advocate for the child in a way that the child can't advocate for themselves without you.
Thank you. And Mariena, you said you have a quick answer, and then we'll formally close this.
I do. Everything the Reverend just said. Love. The Human Rights Campaign has a really great resource that I defer to a lot. It's called Supporting Transgender, Non-Binary, and Gender Expansive Children. And it's a really wonderful handout you can read and learn yourself, like language to talk with families. And it's also something, if they're open to, they can read, but it goes over a lot of things the Reverend talked about and some of the other panelists. It's a really great tool.
Thank you. And on our Queering EMDR website, over the months, we're going to be building a larger library of resources that our various contributors have submitted towards the book. Human Rights Commission, hrc.org, is one of the organizations that I put into chat that we're elevating today to perhaps consider making a donation towards to support that good work. So yes, your evaluation link, I'm going to post that through one more time. You do have to fill this out. And then I know this, because we had some tech issues earlier today, please make sure that your email is entered correctly because that evaluation will populate to your certificate, which will come to your email. And one of the biggest issues of why people don't get their CE certificates is that it's like 1 digit off in the email. I've done it too, no judgment. So just make sure the email's entered correctly. And then if you run into any issues at all with your CE certificates, please send an email sooner rather than later, like by Monday or Tuesday, to the Institute for Creative Mindfulness home office, which is support@instituteforcreativemindfulness.com. And we will be sending around an email and then posting something in Thinkific, letting you know when the replay of this webinar is available. We're going to have this on YouTube as well. Please share this in your communities. This is ICM's free Pride resource. We want to make this available to as many people who need to see it. Again, we could only offer CEs if you were here in real time. But I look forward to having even more of you. Hello, if you're one of those folks watching this on the recording. So, Roshni, any parting words?
Just wonderful to be here with you all. Thank you so much for taking time out of your day to be here with us or to watch the recording. These are some of my very favorite people in here, so I'm always happy to be hanging out, hearing your beautiful voices and so many different great suggestions. So go out and do great things, folks. Thanks so much for being with us.
Go out and do great things. The webinar is officially over, which means you're officially